Now. So welcome to the Tejano virtual event. My name is Kristen Sanchez, and we have a great presentation for you today. We have Mr. Hector Padilla, who's with the Emergency Management Program here at EPCC. And he's going to be talking to you all today about what we do here for emergency planning. And for attending today's workshop, you have the opportunity to earn Tejano passport points. And so during the workshop, you're going to see a code placed in the chat so that you'll be able to get points for attending today's workshop. So please get comfortable, mute your mics. And if you have any questions, you can put them down in the chat box. And so, Mr. Padilla, whenever you're ready, you can begin.
All right. Well, thank you, Kristen. Again, my name is Hector Padilla. I'm the emergency manager with El Paso Community College. Just to give you a little history of myself, my experience in emergency response and preparedness actually began back in 1993 when I joined the El Paso Fire Department, and I was with that department for 24 years. I retired in May of 2017. And then after that, I went to El Paso Water. I was a safety planner for them. And then sometime in 2019, El Paso Community College actually created a position for emergency manager. And so I applied, and I was fortunate enough to get the position. I started here in October of 2019, shortly before COVID hit. But in that beginning that October until March, when we were in the middle of the pandemic, I had begun getting things ready and improving our emergency response planning and things like that. And I'll get a little more into that. And then just to give you a little bit of my educational history, I actually started my higher education here at community college. I received my associate's degree in fire technology, and then in 2010 I went to West Texas A&M University, where I got my bachelor's degree in emergency management. So I appreciate you all taking the time to attend today's workshop. For those of you that attended my leadership in times of crisis and emergency preparedness training through human resources development, this is kind of a blending of those two training. So a lot of it will be, you would have already seen it before. So just, again, I appreciate your time for coming in and joining today's session. So today we're going to talk specifically about our college emergency response, how we go about responding to various incidents that the college may encounter. So specifically, we'll talk a little bit about what my office does. I am an office of one at this time. I hope in the future to expand this office by 1 or 2 individuals, specifically trainers. I'd like to hire a trainer to help me go out and provide training to our college community. We're also going to talk about 3 types of emergencies, which we tend to encounter a lot in the emergency management field, and we kind of categorize them according to these 3 types. We'll also provide an overview of the college's emergency response resources. We'll discuss EPCC's emergency response procedures and response levels. And then we'll also talk about the Tejano Alert System and the emergency preparedness and response plan that is available to you all in the college to fill out for your areas, so that you would have a good idea of what you would need to do in case of an emergency. And I'll speak more to that a little bit later on. So my office specifically, I'm responsible for developing and maintaining the college's emergency management plan. Okay, EPCC being a community college, a junior college, we're actually required to submit our emergency plans to the Texas School Safety Center on a basis for their review. And in fact, I just sent it off, I believe, in September, and we're still waiting for them to respond back. And basically what they do is they go through the entire plan. They identify anything we may be short, and committing to or developing, and then they'll send us back that feedback. And based on that feedback, we'll adjust our plan. And then if it's something glaring, which thankfully it has not been, but if it's was something to be of an urgent nature, they could require us to submit a revision immediately, within 30 days or so. But thankfully, they've never asked that of us. Also coordinate the development of a continuity of operations plans. And those are just plans that a particular department in the college would have to implement in times of crisis. Okay, so, you know, whether it's finance or instruction, IT, if they were to experience any type of serious event where we would not be able to have access to a particular college campus, then they could implement these plans to help them continue their operations, whether it be from another campus or from or remotely. Now, in all honesty, this is something that we are kind of lacking in. We have looked at, well, we did purchase some software. There's been some issues in trying to get that software up and running. But institutional research and planning, Ms. Christy Fresca, she's in the process of helping me develop a plan or template, I should say, for these continuity of operations plans. And if we're able to get that up and running quicker with her assistance, then I would be looking to reach out to all of you, especially those that are responsible for different areas, and helping you all develop your operations plans. Also coordinate emergency preparedness planning for individual college departments. And that's more about the emergency preparedness plan that I'll talk about a little later in the presentation. I also develop and conduct tabletop exercises for college leadership. And last month, we actually had a tabletop exercise that involved our emergency management task force. And we had a scenario where we had a train fire over there in the train yard adjacent to downtown off I-10, and how that would affect the Rio Grande campus. So we had a good turnout from our task force. We also invited Dr. Hajar to attend, her being the campus dean, and having her sit in so that she would get an idea of how we would go about responding to that particular type of situation, and some of the steps that we would need to take in order to ensure everybody's safety. I also am responsible for activating college leadership when an emergency event occurs, specifically cabinet, and I identify those individuals as our executive emergency response team. That was a name that Ms. Mary Beth Hahn came up with, which has been really great in using it. And so we identify those individuals. And so we have an emergency. I contact these individuals initially by text. And then I let them know, hey, we got a situation going on. I'm going to kick off a Teams meeting in 5 minutes, let's say. And we have our own Teams page for this particular group. But we would also meet face-to-face depending on the situation. So whatever incident we may be dealing with, just know that we notify college leadership as soon as possible. Also, I coordinate response efforts between college administration, you know, Dr. Sadata, the VPs and AVPs, with other outside organizations. For example, the Department of Public Health, Paso Office of Emergency Management, et cetera. And I'll give some examples of how we've collaborated with those organizations to just help keep everybody safe here at the college. And then also I develop and conduct training for EPCC employees and students, similar to this one. And again, as I mentioned earlier, the leadership in times of crisis and emergency preparedness training that I've had or that I've held since the beginning of this year in January. And in fact, we'll hold our last virtual sessions this Monday with Ms. Mari Reyes. She's helping me coordinate that. And so on Monday will be our last training for those particular topics for this year. So emergency, as defined by the Britannica Dictionary, is an unexpected and unusually dangerous situation that calls for immediate action. So some of those examples of an emergency include a traffic accident, a sick or injured person, severe weather, such as flooding, high winds, and winter storms, which are very common here in the El Paso area. We can have a hazardous material spill or fire, similar to the tabletop exercise that we held in October over at the train yard by downtown. We could have a building fire here on campus, or the dreaded active attacker shooter type situation. So 3 types of emergencies I'd like to cover with you. And these are defined by Harvard University. And the first one talks about routine emergencies, okay? And by routine, we don't necessarily mean easy. Routine basically refers to the predictability of the situation. They're of a general nature that permits advanced preparation, allows us to take advantage of lessons learned from prior experiences. And usually an organization, when dealing with routine emergencies, have done some type of training or exercises related to those types of emergencies, just because they're so common. And since they are so common, you want your personnel properly trained in how to respond to those types of situations. And they're likely to have identified what we need to plan for and what is needed. Okay, so the picture there at the bottom right is a flash flooding incident here in El Paso. And actually that's Diana Drive over there in the Northeast. And this was a flooding that occurred, I think, sometime in 2000 and let me see, 7 or so. I can't remember exactly, but what happens with El Paso, as you all know, we get these downpours of rain, and the soil is not able to absorb it quickly enough, and so it ends up what ends up happening are these flash flood types of situations. So there's Diana Drive in the Northeast El Paso. So you have the traffic that goes in each direction, and then you have like that irrigation ditch or that drainage ditch in the middle, and you can see how quickly that ditch can be overwhelmed, and with the water kind of going over the banks of the ditch and then affecting the roadway for those drivers that are trying to either get home or to wherever they're going. People don't understand how quickly those streets can be flooded and how quickly their vehicles can be overtaken by the strength of the flowing water. And in fact, many years ago, I used to work at Fire Station 16, which was up the road on Hercules Drive, close to the mountain. And we had one of these flash flood incidents. And unfortunately, an elderly lady in her van was attempting to get home on this very street on Diana Drive, and her vehicle was actually washed up and over those kind of barriers there into the main flow of the drainage ditch, and her vehicle was actually wedged up under a bridge that kind of crosses between the two sides of Diana, and unfortunately she drowned. And so that's why it's always important, you know, for you all, for the general public, to be aware of these types of situations, and just, you know, if you can, avoid this type of driving condition, because it doesn't take much to overwhelm your vehicle, for it to stall, for you to lose control of it, and then to be to kind of float away, and then in that situation, you know, it's just not a good position to be in. So the next type of emergency is called a crisis emergency, and these are distinguished by elements of novelty. By novelty, we mean unusual, you know, something that's not rare. These are threats that were never encountered before, a familiar event occurring at an unprecedented speed, usually a combining of external forces, while not new in combination, pose significant challenges. And that's probably the key point to a crisis emergency, is that fourth bullet point, is a combining of external forces, while not new in combination, pose significant challenges. And because of their novelty, plans and behaviors that work well for routine emergencies that we discussed in the previous slide are often inadequate. Okay, and these types of events require that you identify the novelty of the event. I'm sorry, it's a little covered there, and improvise your response. So there you see September 11th, right? The attack on the Twin Towers, and the different components that led to that particular event. We all knew terroristic events took place, right? And in fact, I think a decade prior to, more or less, they actually had a car or truck bombing in the underground parking garage of the Twin Towers. So you had a terroristic event. We knew that, you know, they had already tried to attack the towers before. There had been aircraft hijacking prior to. And so, you know, you had all these different types of events that as a country we were aware of, we knew that took place, but never did we imagine that you would combine all these elements to where you would have these terrorists fly these airliners into the Twin Towers. Okay, for the fire department in New York and the police department and you know, the other responding agencies, they were overwhelmed immediately. Okay, because no amount of training and I dare say any of their planning had anything like this in mind. Okay, and in looking at the situation, I remember the morning that September 11th happened, my wife and I were getting our daughters ready for school. They were still little girls, and I turned on the news. We would always play it in the background as we were getting ready for the day. And right away, I saw what was going on. And at the time, the first tower was on fire. So I thought, wow, you know, that's a pretty serious high-rise fire that they got going on there. And then a few minutes later, the second plane hit. In the fire service, we're required to take hundreds of hours of training in building construction because you need to be, as a firefighter, you need to be aware of the effects of fire and how they attack the structural components and stability of a building. And so when I saw that second plane hit and understood what the situation was, immediately I knew that those buildings were not going to last long because they were not designed to withstand that type of impact. You know, put the fire aside, you know, the fire was bad enough, especially at being fueled on with the jet fuel that was loaded in those planes. But the structural integrity of those buildings were not intended to withstand that type of impact. And knowing that, you know, it was a scary situation because I knew those firefighters and other responders that were entering the building at the time, trying to get as many people out. You know, I really believe that they knew a lot of them would not be coming out. You know, I think they understood what the job was at hand, and they did it bravely, and they knew going up into those towers, into those stairwells, trying to get as many people out was the main goal, and that they themselves were probably not going to make it out. And then finally, we have the emergent crisis. Okay, these pose special challenges in terms of recognizing novelty because they look much like routine emergencies in the early stages, but as the event progresses, they reveal their unusual characteristics. Okay, leaders are often slow to recognize these new aspects and tend to remain committed to the original pre-planned solution. So as you can tell there with the picture there at the bottom right, I'm referring to the COVID-19 pandemic that we've just recently got out of. Now, when I took this position in October of 2019, as I mentioned before, this was already kind of on our radar. At the time, I was actually monitoring a website from Asia, and I can't remember the actual agency that was providing the information, but what they were doing is basically almost hour by hour, they were updating the total number of positive cases of COVID-19 in China. And so as you saw these numbers slowly get higher and higher and higher, you knew that it was a bad, or at least I knew it was a bad situation. And so it was actually in November, I briefed out Chief Ramirez because my office falls under El Paso, Community College Police. And so Chief Ramirez is my supervisor. And so I briefed him out and saying, hey, this is on the horizon. This is something that we probably need to be concerned about. And, you know, he instructed me just to monitor it. It wasn't really, it was on the news, but it really wasn't getting the attention that it probably deserved. And I knew here, and I, from remembering what was going on back then, I don't think the country was doing much to prepare for the inevitable arrival of the virus. And actually, you know, I really believe that that people were already sick here in the United States with the virus, and we just had no way of testing for it. And so I continued to monitor it up into the Christmas break. We went on Christmas break. We came back, and the numbers are just astronomical by that point. And so we began discussing it here at the college, kept a closer eye on things. And D-Day for us, so to speak, was in early March. And I'm part of this email group of other emergency managers from different universities and colleges throughout the United States. And I think it was March 4th, I can't remember the exact date, but the University of Washington, up in the state of Washington, sent an email out to all the emergency managers that were part of this group. And they were letting us know that they were shutting down their campus. They were sending all their students home. They were literally throwing them on flights as quickly as they could, because by then the virus had really taken off in the university setting and then also in the elderly care setting. And so they were shutting down the campus, and they were saying, you know what, we don't know how long we're going to be down, but just to let you know, we are sending our students home. And so with that email, I met with the chief. We got a meeting immediately with Dr. Serrata, and we were discussing what our next play was. And so that the decision was made to, let's just get us to spring break and evaluate how things are progressing during the break, and then determine what action we're going to take. But as you all remember, 1 week of spring break turned into 2 weeks, and then 2 weeks turned into 2 years. And in that meanwhile, as you all remember, the college was adjusting, going from face-to-face to virtual or to distant learning. And then we had to begin making the preparations, I should say, in getting people back to work and back to school. Because as you all know, there's lots of degree plans and programs that are dependent on that face-to-face instruction. You have clinical hours and things like that. And so as early as May, we were already making preparations to have some students come back, for the nursing programs, for automotive, those types of programs. And so we were taking the necessary steps. But with COVID, it was unique because, I don't say it was unique, but I think they had the idea that they were going to treat it as any other pandemic. But as you all remember, and not only just in the United States, but all over the world, everybody was overwhelmed. There was no test readily available, although we knew lots of people were sick from it. There was no test available initially, and then as you all know, the vaccine thing and social distancing and things like that. And just to share a little story with you, my brother was actually the first confirmed positive tested case here in El Paso. And what happened with him was, in fact, he tested positive on March 13th, or that's the day that they announced his positive test result. And a week prior, he had gone to California for some training for a company he works for, and he came back and he was super sick. And I suspected that he had it just based on the symptoms and the severity of how ill he was. And my brother, being pretty healthy, young, I was convinced that he had it. And so he was going to the doctor, and he was telling these doctors, like, hey, my brother thinks I have it. And they're thinking, well, who's your brother? He's not a doctor, right? But the main thing was they just didn't have a way to test for it. So when he started developing some severe respiratory problems, he went to the ER, and he actually had developed pneumonia. And thankfully, that day was the first day that they actually had tests on hand. They tested him. He tested positive. And then from there, it was official. Prior to that, I had already been in contact with the Office of Emergency Management. I had already told them, I said, look, I'm pretty sure my brother has it, as many other people probably did at the time in El Paso. But I was like, I'm pretty sure he has it. Y'all need to be prepared. And they were like, yeah, we'd like to implement these steps, but we can't until we have a confirmed case. And unfortunately, my brother was the first confirmed case. And once that case was announced, I think you all remember the city had a press conference over at the Office of Emergency Management, and they began sharing the things that they were going to do to hopefully keep everybody safe. So COVID was definitely unique, a scary time. Hopefully, if anything like this, hopefully it doesn't, but if it ever does in the future, we're better prepared and we'll handle things a little bit differently. I won't get back too much into the details of my opinions of what happened, what we did well and what we didn't. But hopefully we'll just be better prepared in the future. So here, the next slide is the college's hazard summary, and this is part of our emergency management plan that I mentioned I submit to the Texas School Safety Center every year. And so this is a breakdown of potential incidents that we could face here at the college. So if you look at the far left column, you have the hazard type, and the hazard types are broken into categories. For example, you have natural hazards, technological hazards, human-caused hazards, and hazardous materials. Okay, and under each of those major topics or headings, you have specific incidents. For example, under natural hazards, you have drought, and under technological, you have IT systems failure, and so on. Okay. If you look down where it says human-caused health hazard, and you look at active shooter, the very first item there listed, as you progress from left to right, we have different columns associated with that particular incident. So the first column being the probability of an active shooter situation happening on campus, we have it as a moderate. Okay. We could adjust that depending on any intelligence that we get, but every year we go through these incidents or potential incidents, and we give a probability of what we think this event, or could this event occur. So for active shooter, we have it at moderate. For severity of impact or public health and safety for that same event, obviously it would be high, right? Because unfortunately during those types of situations, you would have casualties, people that would be shot, injured, wounded, so on and so forth. Severity of impact to property, we have it as high, and then business operations impact obviously would be high. Any active shooter situation that we were to have on campus, in whatever campus it occurred at, or whichever building, similar to the Walmart shooting that we unfortunately experienced here in El Paso, El Paso Community College would basically lose access to that building for a good period of time while the investigators do their thing, the FBI collect evidence and so on. And then when they turn the building back over to the college, then the college has to decide, well, how are we going to go about putting this building back into service? Do we gut it and remodel it so that we don't have it in a way that's going to maybe trigger somebody in the future, or what are we going to do? And then once you decide that, then of course you have to go through the whole process of getting the contractor and the funding and all those things. So it's a pretty lengthy process. So these are just examples of the potential types of incidents that we could have here on campus. And we go through it every year, as I mentioned before, and we assign values as far as the probability, the impact to health, the impact to the property, and then how it's going to affect the overall business operations of the college. So some resources here that we have at our disposal at the college to help us deal with any type of incident. First of all, we have our police department, which is headed by Chief Ramirez. As you all know, there has been a shortage of police officers on campus, and they are taking steps to hopefully improve that. I think they've hired 1 or 2 in the last month. So hopefully the staffing for the police department will improve. I think right now they have 27, 28 patrol officers. Don't quote me that exactly on the exact number, but they are looking to improve the staffing to hopefully provide better coverage for the different campuses that we have. And then we also have our emergency management, or Department of Emergency Management. That's what I do. That's what I head up, as I shared with you earlier. And then we have our Executive Emergency Response Team. As I kind of mentioned briefly, this is what we call the EERT. And this team is made up of Dr. Sanata, the AVPs and VPs. And these are the individuals that we get together for an emergency, and they they handle the situation administratively, okay? And I act as the bridge between the ERT and the units on the scene handling whichever emergency we may be facing, whether that's our own campus police or the fire department, just depending on the situation, okay? So this team, they know that they need to be readily accessible to me. I have all their cell phone numbers. We have our own text group, emergency text group, and they know that if something happens, I'll get a hold of them, and then we'll usually jump on Teams, because usually a lot of our leadership, they're everywhere, right? They could be at conferences, they could be at a different part of town, attending a meeting or a different campus. And so I'm thankful for Teams, because that really allows me to get the team together rather quickly, so that I can brief them out on what's going on, and they can begin making the decisions that they have to, and dealing with whatever incident we may be facing. And then we have our Emergency Management Task Force, the EMTF. This group actually meets monthly, and they are from different areas: physical plants, institutional research and planning. We have PD there. Dr. Mitchell participates in this. And so this group meets monthly, and we just discuss items or topics related to emergency management. And so whatever may be deficient, or whatever we may need, this group gets together and we discuss those things, and usually we formulate some type of game plan to address whatever situation we may be facing. And then we have our Critical Incident Response Team, our CIRT. This team actually was recertified this past July. Dr. Mitchell headed up that effort, and I was actually able to attend this training. And so what this group does is, for any of those types of situations that may affect the college campus or community, say for example the death of a student or faculty, this group can mobilize and provide some immediate counseling services for whoever may be affected by that particular event. And then they kind of provide this debriefing type of service, and if they identify that maybe this individual needs some longer term counseling or what have you, then they can refer them to other agencies or through the EAP, and ensuring that those people get the help that they need. And then we have our EPCC Behavioral Intervention Team, known as the EPCC BIT. This team is relatively new, but what this team does is they get together and they investigate items related to behaviors of concern. For example, we may be a student threatening another student, or students threatening faculty. What this team does is they get the initial report, all the information associated to that particular case. They look at it and they assign it a threat level. The threat level can be from no threat all the way to severe. And depending on that threat will determine what course of action the college takes in dealing with that situation to hopefully prevent it from escalating to something worse. And so again, it can be, no action taken to severe. Severe, you'd be looking at something where campus police would get involved, and if necessary would make an arrest, or something along those lines. And so to date, the cases that the college has dealt with is usually, items related to behavior. We've had some situations where students have been suicidal. They've thought of committing suicide. We've had, other students or a student threaten another student, or maybe become very agitated, verbally abusive towards faculty. And so this team investigates those types of situations. Just know this is a work in progress. Dr. Mitchell and Dr. Amaya, they head up this group, and they're in the process of purchasing some management software that will help us manage these cases, and also provide a website for our college community to be able to go on there and report any situation that they deem is necessary anonymously, and then this way it'll be flagged over to the BIT, and they can begin their process of investigating that particular incident. Any questions so far? I know I provide a lot of information. Okay. So some external emergency response resources that we have. Of course, we have the El Paso Police Department. We have the El Paso Sheriffs who would respond to our Mission del Paso campus. We have other law enforcement agencies, for example, FBI, Border Patrol, Fort Bliss. Also, the school district police departments are also a resource that we have. We have the El Paso Fire Department, the El Paso Office of Emergency Management, the Texas Department of Emergency Management, or TDEM, and the El Paso Department of Public Health. And these are organizations, agencies that we work closely with. For example, the Office of Emergency Management and TDEM during the pandemic actually approached me and said, hey, you know, we're in the process of standing up some testing sites for COVID. Do you think El Paso Community College would be willing to set up a testing site at the Valle Verde campus, because we need a location that's accessible to our Lower Valley population? And I said, you know, yeah, let me check. And so I got on the phone with Dr. Serrato, who's great. You know, I can call him directly at a moment's notice, and I made the pitch to him, and he said, absolutely, let's get it up and running. And so, of course, there's some other steps involved, and you know, you have to enter into an agreement with the city and with TDEM, and then you send the language over to the attorneys, and they work that out. But it basically took about a week to hammer everything out. And so we actually got that testing site up and running in July of 2020. Yeah, 2020, and it stayed in service for one whole year until July of 2021. And in that time, I think they administered over 75,000 COVID tests. So really effective operation, provided we were able to be good partners. Dr. Mo likes to use the term good partners to the community, and she's absolutely right. And it just showed that community college was willing to help out the greater community any way we could. And so it was a really good partnership. And so we still have agreements in place for mass prophylaxis dispensing between the college and the city of El Paso. So if anything like this were to happen again, then we could actually, you know, help out in dispensing vaccines or anything that may come up that way. And of course, if we needed to stand up another testing site, I know we have the capability, we have the space to allow us to do that. The El Paso Department of Public Health is another great example of a good partnership. In the last couple of years, they have actually contacted me and said, hey, we need to speak to you all because we're dealing with a severe case of tuberculosis. This individual is really ill, and they have shared with us that they are part of your college community. And so once we identified this individual and we figured out in what way this individual is part of our community, we were able to identify the people that they came in contact with, and the health department was able to send out notices of exposure to those individuals, notifying them that they were potentially exposed to tuberculosis. And then also part of that partnership, we gave the health department a location at one of our campuses where they could give TB testing to those individuals that were potentially exposed free of charge, and maintain their privacy so that they could begin monitoring to see if these individuals had actually developed tuberculosis. And thankfully, in both cases, we did not receive any information, or I should say notification from the health department that anyone else within the college community had actually tested positive for tuberculosis. So just another example of how we work with other agencies to keep you all safe. So here is a breakdown of how we conduct our emergency response. And this is for an incident that occurs on campus. And so as you see there, the chevrons on the left, we get the report of the incident either to our own police dispatch here at the college or through the 911 call center. And just to let you know that our police dispatch at the Valle Verde campus is directly tied into the 911 call center over there in the Northeast. Okay, so if the call goes into 911, we're made aware of it here at the college pretty quickly within seconds, or vice versa. If the call comes into our dispatch and we need assistance, we can request that assistance from like El Paso Fire immediately through the 911 call center. Okay. Or you may have a report or an incident that's reported directly to one of our officers, but that's usually how we get a report of the incident here at the college. We respond to the incident, and if we deem that incident to be a critical event, as shown there in the second chevron there, if it is a critical event, Then we begin the process of sending out the Tejano alert notifications along with periodic updates. They'll let me know so that I can in turn contact the executive emergency response team and let them know of the situation we're facing and what our level of response is, and I'll go into the levels shortly. And then from there, we continue to monitor and manage the event. And once the incident is terminated, when things are back under control, we update you all through the Tejano alert. We update our response level, and then we can begin the process of recovering from whatever particular incident we were facing at the time. I think there's a question there. Okay, thank you.
About the PowerPoint, yeah, and I think Patricia is putting some information on how you can get a copy of that PowerPoint.
Okay, perfect. Thank you.
Thank
you. Okay, so the next type is our emergency response for an incident that occurs off campus. Okay, so same kind of flow. You have the report of the incident. In this case, usually the campus police directly receives information of an incident, or the Paso Police EPCC police determines the threat level to the college. So they'll, through dispatch, through the 911 call center, will be notified of a particular event. And they also receive reports, what they call from the fusion center, and that's just kind of like an intelligence center here locally. If it's a potentially severe threat, they will send an email to our campus police officers or to chief and to some of the other lieutenants, and then they in turn notify me. So if there's a potential threat as stipulated in the second chevron there to the college, we will issue a Tejano alert, and then they notify me, and then I notify Cabinet Dr. Sarata and his team to let them know what's going on. And then once the incident's terminated by whoever on the outside is responding, whether it's El Paso Fire or if it's El Paso PD, Sheriff, or wherever it may be, once we get notification that they've finished the incident, they've terminated the incident, then we will let you all know through Tejano alert. We'll update our response level, and then we'll resume normal operations. And so the example I like to give of this, because sometimes, especially through social media, we'll get notification of an incident, and you all too, right, through FitFam, Facebook, those types of social media platforms. But just understand, even though that we get them through those avenues as well, we always have to verify the incident through the 911 call center or through the incident commander of whoever is managing that particular event. And once we confirm that we do in fact have a legitimate incident, then we begin the process of notifying you all. A couple of years ago, they had the shooting over at the Sila Vista Mall, not the Walmart shooting, but the one that occurred inside the mall. And so we actually got word of it rather quickly through social media. I had a niece that worked at the Apple store. She actually, called me, and I just told her, look, just follow the instructions of your bosses. If they're telling you to lock down, lock down. And I called the chief, and he's like, yeah, we're in the process of verifying it. A couple of minutes later, he called me back. He's like, yep, we got a shooting over at Sila Vista. And that's when we sent out the Tejano alert to the ASC and to Valle Verde that we're going to shelter in place, because at the time we had received intelligence that there was a second shooter that had fled the scene in a black SUV. And so, we had to shelter in place to ensure everyone's safety. That was here at the AAC and VV. This was occurring after, I believe it was sometime after 5 in the evening. And we had to begin the process of ensuring that our campuses, these two particular campuses, were safe so that we could begin the process of allowing people to leave campus safely. And just understand that sometimes these operations take some time because, as you know, VV is pretty big. The two buildings here at ASC are pretty big. And it takes some time for the police officers to secure the exterior perimeter to make sure that we didn't have that vehicle by that description at one of our campuses, secure the perimeter, secure the parking lot, and then begin going inside the building and clearing the building room by room, because you just never know if that individual happened to walk into one of our buildings and maybe was hiding. Okay, so sometimes an incident that occurs off campus can affect us greatly, and it will take us some time to go through the process to ensure that you're all safe. Okay. So now we'll talk about our response levels, and these are the levels that we have in our emergency management plan, and we apply these levels to whichever incident that we're facing. And so the first one, and just know that Dr. Sarata, or his designee, which is usually me, is responsible for determining the appropriate readiness levels based on current conditions affecting the district. So the first one there, normal operations, that's what we're under probably 99.99% of the time, okay? We may have incidents that occur from time to time, like you might have somebody that gets sick on campus. We have to call El Paso Fire for assistance, and then that individual gets the care they need. Either they're transported or they refuse transport, just depending on the situation. But that's not a particular incident that would cause us to send out a Tejano alert or do a lockdown or anything, or a shelter-in-place type of situation. Just know that we can be under normal operations, but have minor emergencies that occur on campus. Now, from normal operations, our next level is level 1, increased readiness. And this is where regular college operations are slightly affected. Okay, the situation presents a greater potential impact to the college, but poses no immediate impact to our operations, life, or property. The evolving situation will be monitored by EPCC Emergency Management, myself, to determine and recommend the college college administration if additional protective measures are needed. So, for example, usually we're at a level 1 rated readiness for some inclement weather that may be coming into the borderland. Last January, there was some very cold Arctic air coming into the El Paso area. Where the wind chill was going to be like in the low teens. And it was something that we were monitoring throughout that weekend. We got the National Weather Service update the previous Thursday. And so throughout the weekend, I was monitoring the situation. And I know that Sunday night, El Paso Independent School District decided to do a delay opening, specifically because they didn't want the kids to be out waiting for the buses at the bus stop, so they decided to do a 10 o'clock open. And so, we were on the fence about doing something similar because, for us, the whole thing was, okay, it's going to be cold air, but is there any moisture associated with that weather impact? Because as you all know, with low temperatures and moisture, then we have iced over streets and things like that. And so throughout the weekend, I was monitoring it. And thankfully, no moisture came with that cold front, and we were able to keep a normal business day for here at ASE and for our other campuses. Now, a lot of people, and I get it, some people, especially that have their kids that are in these affected school districts, want us to delay an opening, but we go based on what our capability is and how that particular weather event would impact the college as a whole. Not to sound insensitive or anything to parents' needs, and I get it. I remember when my girls were little and having to worry about childcare and things like that. But just know that we base our decisions on how whatever situation we may be facing will impact the college, okay, as a whole. Now, the next level up is response level 2, or level 2 high readiness. And this is where the college will experience some level of disruption. So, for example, if that cold front last January had brought in some moisture where the streets were icing up, we would upgrade to level 2 high readiness, and then probably have done a delayed opening, depending on what the street conditions would be like later on in the day. And then finally, there's our level 3 maximum readiness. This is a large-scale disruption of the college or to college operations. This incident causes widespread disruption to the college. The conditions require warning to faculty, staff, and students. EPCC personnel and outside agencies are required to support operations. So the best, I don't want to say best, but an example of the maximum readiness would be the active shooter type situation, okay? If we were to happen to have that type of incident, we would definitely be at a level 3. and we would make the necessary notifications and adjustment to our operations depending on where that event was taking place and what intelligence we may be receiving, not only internally from our own police department, but also from outside agencies, El Paso PD or the FBI. Any questions on the response levels? Okay. Then the Tejano alert system. I know a lot of you probably are already registered, but if you're not, please look at the QR code there and make sure you register. This last weekend when we had the power go out at Valle Verde, we were trying to make the determination as soon as possible as to whether or not we would be able to restore power. When it was realized that we weren't, and we tried to, or we sent out the Tejano alert, and I know it was kind of close to the beginning of the school day, we still had lots of students show up throughout the day because they were not registered with Tejano alert. Okay, we need to do a better job, and we being me, to getting this information out so that students can register. I've asked for a little bit of time at student orientation, maybe just 10 minutes, where I could specifically just talk about our resources available to the students, specifically Tejano alert, so that we can get as many students registered with this valuable alert system that we have. But with the time for new student orientation, I know it's very guarded, and I'm hoping to get my foot in the door on that, and hopefully this next coming semester they'll improve that. And so real quickly, I just want to share with you our emergency preparedness and response plan. This is the plan I mentioned at the beginning. This is available to you all to fill out for your areas, or even your instructors. If there are any students in today, you can approach your instructors and share this with them. Any field that is in teal green or in red is a fillable field. This is a Word document that you can adjust to meet your needs. But this is just a plan, and you can be found in the district forms under My EPCC under emergency management. You can just download a copy and fill it out for your area. And this is just a breakdown of different types of emergencies we may encounter here at the college. For example, within the document itself, you have fire extinguisher use, building evacuations, campus evacuations, how to identify your evacuation sites, how to deal with a medical emergency, bomb threats, suspicious packages or objects, sheltering in place, and active shooter, hostile intruder. So it gives a good breakdown of these different types of emergencies. This way you can fill it out. It's real simple. It's not a lot that you need to fill in, but just fill it out and then share it with your team. Give them copies. You can print out a copy. You can send it to them electronically via email. And then what we're also asking of you in filling out this plan, not only just to do it, but also to train on it. And if you need any assistance with that particular training, let me know. I'm more than happy to go out to your campuses and help you all implement this plan and train on it. And then here is the QR code for our emergency preparedness page within the college website. I'm pushing really hard to get this information direct linked on My EPCC so that it's easily identifiable. So when a student or employee logs into My EPCC, there's a button there or a tab somewhere on the screen where you can click on it and all this information will be provided to you. But again, it just goes more into depth on the different topics of fire evacuations, bomb threats, and things like that. So, you can click or use your QR code scanner to bring up that website. Or you can just do a search on the search engine for the college website. Just put in emergency preparedness and it'll bring up that link. And there's my contact information and my email address. That's just the generic email for my department, and then my office extension. Any questions?
Well, thank you, Mr. Padilla, and I have to thank you. I can't imagine starting in 2019 and then the next year we have one of the biggest events of our lives happen. So you did a great job because you really helped us through that area. So I give a lot of uh, thank you to you for that. So does anybody have any questions for Mr. Padilla? Well, thank you again for being here today, Mr. Padilla. We did learn a lot, and I invite everybody to please sign up for Tejano Alerts because they do provide you with a lot of information, such as closures or things that you need to know about what's going on the campus. Just go to the police page, and there is the area for you to sign up on that page for those Tejano alerts, as well as on your My EPCC up at the top. There is also something called My Alert information. Just get on My EPCC and look at the top and you'll see my alert information, and to make sure your information is correct, like your phone number and your email. So make sure you're current. So again, thank you again for presenting for us today. We really appreciate your time.
No, thank you all. You all take care and have a good weekend.
You too. Thank you. And thank you to all of you for coming. I have put in the chat box your chat for Tejano points. If you would look in there, you'll see, and I'm going to go ahead and pull up the Tejano passport if you haven't registered yet. It's really easy. You can just scan that QR code right there and sign up, and then use that link I put to sign in and get points for today. Next week, we are going to be having a presentation from the EPCC Culinary Arts. I invite you to come back next week at 1 o'clock on Friday to hear from them right before our Thanksgiving break. It'd be nice to see what Culinary Arts is going to be whipping up. And I appreciate you all coming, and I hope you all have a great weekend. Take care.